17, Cognitive Impairment, Alzheimer's Disease, and Dementia. The words cognition and cognitive relate to activities of the mind that are involved in thinking and thought processes. Cognition includes intelligence, learning, judgment, reasoning, knowledge, understanding, and memory. These are all higher brain functions. A cognitive impairment is a disruption in higher brain functioning that results in confusion. The client's ways of knowing and understanding the world have changed. There are various factors that influences how one ages mentally. Our culture, education, health, genetics, diet, physical and mental activity, and our living conditions all influence our cognitive or intellectual abilities. We all age individually, but one thing is definitely certain: confusion is not normal. Any damage from head injuries or conditions that cause a lack of oxygen or hypoxia to the brain can lead to confusion. This can be exposure to chemicals, toxic substances, or diseases that are able to cause brain damage and confusion. Anything that interrupts or alters the blood supply or the nerve pathways in the brain may result in either acute or lasting mental confusion. When an individual's focus is on inner sadness, outside stimuli may be misinterpreted or misunderstood. Then the individual will become labeled as confused, and the underlying depression is actually ignored. Commonly, confusion in older adults is seen with sensory deprivation. There are many medications that may cause confusion. Medications used to treat allergies, arthritis, high blood pressure, irritable bowel syndrome, migraines, pain, Parkinson's disease, antipsychotics, sedatives, hypnotics, and some over-the-counter medications like cold and flu medications, diarrhea, hay fever, or insomnia. Memory loss is the inability to recall a certain detail or an event. Delirium is a change of consciousness that occurs quickly. Delirium is a reversible syndrome that comes on suddenly. Usually it's a result of metabolic, nutritional, or a toxic disorder. Think about hypoxia, hepatic or renal, kidney disease, post-operative patients sometimes, psychoactive substances, alcohol intoxication, or even alcohol withdrawal. Signs and symptoms of delirium would include disorganized thinking, decreased attention span, lowered or fluctuating level of consciousness, disturbances in the sleep-wake cycle, disorientation, and changes in psychomotor activity. Antibiotics are given for many infections. Older adults lose their sense of thirst, and delusions often subside quickly as water and minerals are replaced. If medications are the cause, they are withdrawn. Depending on the medication, some need to be gradually, and the patient is watched closely. The second focus of our care is providing an environment that has very few stimulus materials or stimuli within it. That helps the client to remain calm. As a nurse, we never want to try to talk our patients out of delusional states or convince them that they are wrong. Their reality at this time is really different, but to them it's very real. So we need to make sure that we use a low, calm voice, and we want to make sure we maintain eye contact. Dementia, this is a group of symptoms that relate to a severe loss of multiple cognitive abilities. memory, language, ability to think, understand, and reason, like judgment, abstract thought, and it also has the potential for personality and behavioral changes. Some losses are severe enough that interfere with an individual's activities of daily living, their social and work functioning. In dementia, there is no change in a level of consciousness. Dementia is considered an insidious process, having an almost imperceptible start. It comes on very slowly, it's chronic, and usually unreversible. So it can be classified as primary dementia, which would be Alzheimer's, multi-infarct dementia. It could be classified as secondary, and it could be related to Parkinson's disease, heart disease, multiple sclerosis, AIDS, or hypothyroidism. The way to help individuals remember dementia and the issues caused by dementia, use the mnemonic MEND A Mind. M, metabolic disorders. E, electrical nerve disorders. N, neoplastic disease or cancer. D, degenerative disease. A, arterial disease. M, mechanical disorders. I, infectious disease. N, nutritional disorders. Or D, drug toxicity. So dementia and the acronym MEND A Mind will help remember the causes of dementia. There are two common forms of dementia. One is vascular dementia and one is Alzheimer's disease. Vascular dementia is routinely caused by cardiovascular disease, where there is not enough blood nourishing the brain to keep it functioning properly. Dementia, excluding Alzheimer's disease, may be reversible if it is discovered early and then treated. Dementia is either classified as Alzheimer's or non-Alzheimer's type. There are specific signs and symptoms, so they have short-term memory loss, trouble with associating, difficulty in performing everyday or familiar tasks, like make a meal but never actually serves it, may leave the car running, problems with language, forgetting simple words, doesn't understand the usage of words, poor judgment, so maybe inappropriate dress or forgets to watch a child, may leave the house for hours at a time. Difficulty with abstract thinking, so they may stop paying bills, they can no longer balance a checkbook, they have difficulty following a conversation. They may misplace objects, such as maybe putting milk in the oven, a sandwich in a drawer. They are disoriented to time and place. They can get lost on their own street. They lose initiative. They become more passive, sit blindly in front of the television for hours. There's a change maybe in mood or behavior, rapid mood swings. There can be a change in personality. So Alzheimer's has different stages. In the early stage, it begins with recent memory loss and an inability to learn, process, or retain information, followed by language problem. Judgment and abstract thinking will start to decline. In the middle stage, the individual cannot recall any recent events or process new information. Their remote memory is affected, but not totally lost yet. With progression, they will develop aphasia, which is a loss of language, apraxia, which is a loss of the ability to perform everyday actions and activities, and visual agnosia, which is the loss of recognition of familiar items, objects, or people. They may begin wandering, have agitation, and they may show signs of physical aggression. These individuals have lost their sense of time and place, and they are still ambulatory. So this makes them at risk for getting lost, higher risk for falls and accidents. In the late stage, these individuals are characterized by an inability to do anything. They become incontinent, they can't walk, they're entirely dependent on everyone for their care. Memory is completely lost. There is an inability to swallow. This will increase the risk for developing pneumonia and malnutrition. Some individuals with Alzheimer's will develop mutism, which is an inability to speak, or maybe they will only communicate grunting. In the end stage of Alzheimer's, people will slip into a coma, and routinely death from pneumonia or another infection is what occurs. Individuals that have been diagnosed with Alzheimer's disease may live anywhere from 2 to 20 years. However, the average lifespan after diagnosis is about 8 years. There is institutional long-term care, and sometimes it's necessary for the majority of individuals that have Alzheimer's disease. The need-driven dementia-compromised behavior model, this views offensive behaviors as communications of unmet needs. It is thought that an individual's behavior results from the interaction of one's background factors, and they change with the environment. Alzheimer's disease is probably worse for the caregivers because they just stand by and they watch the person that they care about or love just fade into this vague, unconscious existence, and basically they're an individual with a hollow shell. Many long-term care facilities, they now offer respite care for caregivers, so the loved one that has the Alzheimer's is safely cared for while the caregivers gets a break.